Hi, it's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today's tip is a question from Tom, who says, my dad's been in ICU for 30 days and he's been on the ventilator for 30 days. What can be done to get him off the ventilator? Well, that's a great question, Tom. Now, it's a very generic question, but I will break it down in much detail for you so that you can understand what can be done. Now, first things first, you have not shared with me whether your dad is on a ventilator with a tracheostomy or on a ventilator with a breathing tube, because the answer to your question depends on whether your dad is on a ventilator with a breathing tube or with a tracheostomy. Once again, the biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. So what can be done after 30 days on a ventilator, Tom? Let's just say your dad still has a breathing tube and can't be weaned off the ventilator. The first thing that needs to be done is do a tracheostomy. And I don't have anything else to add, because a tracheostomy should be done after about 10 to 14 days on mechanical ventilation with a breathing tube, also known as an endotracheal tube, and the inability to wean off the ventilator. If your dad is at day 30 with a breathing tube, he is beyond the shadow of a doubt beyond weaning, because otherwise he would be extubated and he would be off the ventilator. So let's look at scenario 2, that your dad has been in ICU and on the ventilator for 30 days with a tracheostomy. Okay, so what can be done? So first thing, when a patient has a tracheostomy, going from a breathing tube to a tracheostomy, one of the main goals of a tracheostomy is to stop and eliminate sedation, right? When someone is having a breathing tube, the need for sedation and opiates is there. Opiates are strong painkillers such as morphine or fentanyl. And soon, because a breathing tube in the throat is very uncomfortable and can most of the time only be tolerated with sedatives and opiates. Now, once a tracheostomy has been done, the need for sedation and opiates should stop immediately. So that's number 1. Ask if your dad is completely off opiates and sedatives, because he should no longer need them, right? A tracheostomy is much easier to tolerate in comparison to a breathing tube. Number 2, has he passed any spontaneous breathing trials yet? Is he breathing on CPAP or pressure support? Now, I'm not doing a deep dive today into ventilation modes, but the goal for your dad should be to get on a CPAP or pressure support mode from a controlled mode where your dad is having a set rate breaths per minute from the machine every minute. He should now be weaned off that rate, and he should be able to initiate every single breath so that he gets a flow delivered via CPAP or pressure support. Look out for that. If he's passing spontaneous breathing trials on the ventilator with CPAP or pressure support, he should then move on to be taken off the ventilator, even if it's only for a few minutes a day to begin with, right? And get on a trach collar or a trach mask. Next, he can only really pass spontaneous breathing trials on CPAP or pressure support and move on to a trach collar or a trach mask if his pressure support is less than 10, if his PEEP is less than 7, let's just say ideally 5, if his tidal volumes are adequate to his weight, and tidal volumes adequate to a patient's weight should be 7 to 10 mils per kilo. For example, if your dad weighs 80 kilo and he takes 10 breaths per mil, that should be around 800 mils per breath, right? Between 600 to 800 mils, 800 mils per breath. That would be a good indicator, right? Next, his breathing rate should be within normal limits. Let's just say 10 to 30 breaths per minute at the most, with good tidal volumes per breath, right? His oxygen levels should be above 94, 95% oxygen saturation. And his arterial blood gases should be within normal limits, i.e. pH should be normal, PO2 should be above 70 to 80 millimeter per mercury, PCO2 or carbon dioxide should be within a normal range, 35 to 45 millimeter per mercury. If those boxes are ticked, then he should have spontaneous breathing trials, either on CPAP pressure support, or then the next step is to go on to a trach collar or a trach mask. Next, if your dad is not moving towards that, the next thing that needs to happen, and should have happened already, is to get mobilized and get physiotherapy and physiotherapy, get breathing exercises, coughing exercises, with the nurses, with the respiratory therapist if you're in the US, or with experienced ICU nurses can do that, respiratory therapists in the US, and ICU nurses do it in most other countries, right? Mobilization with a physical therapist, potentially using a cough assist machine, depending on, why your dad is in ICU. You haven't mentioned why your dad is in ICU. Next, good nursing care. What I mean by that is, making sure there's good mouth care, there's good, skin care, regular pressure area care. In a good ICU, your dad will have a shower. They will get your dad into a shower in a good ICU, even on a ventilator, right? We've done that in most ICUs that I worked in. We've showered our patients. There was no issue not showering a patient. You could get them to a shower trolley, even if they were bedbound. So, have a good look whether they're giving good nursing care. Most families in intensive care have no idea what to look for when it comes to good nursing care, but good nursing care is absolutely vital. Imagine you're confined to a bed, critically ill, and you're getting a bed bath, you're getting a wash, you're getting a shower. That's the highlight of your day, and imagine how much better you feel. It's not rocket science, right? And yet many ICUs, are dropping their standards when it comes to good nursing care. A lot of patients in ICU nowadays end up with pressure sores, and that's clearly negligence. No one should have pressure sores in ICU if the nurses know what they're doing. So what else can be done? Optimizing a good day and night rhythm, right? Being awake during the day, being asleep at night. And that could also include, maybe off the ventilator during the day and then back on the ventilator overnight to give your dad a good rest so he can be off the ventilator the next day, and then slowly and gradually move towards being off the ventilator 24 hours a day. And once that's achieved, then, the next step is to ideally remove the tracheostomy. But we're not talking about that today. We're just talking about, to get your dad off the ventilator because he's been on it for 30 days, right? So those are the most important things to look out for, to get your dad off the ventilator as soon as possible. I'll tell you another thing that's important that is often neglected. Regular people looking after your dad, i.e., if he has a different nurse every single day, that wouldn't be good. So, having a team built around him that gets to know him, that can work with him, that understands his preferences, that can work with him, on a regular basis, that will also help to get your dad off the ventilator, right? And if, God forbid, all of that fails, there's always the option to take your dad home on a ventilator with a tracheostomy, and you can take your dad home with intensive care at home. So have a look at intensivecarehome.com. There you can take your dad home, right? So go to intensivecarehome.com if you're really, really stuck with not getting your dad off the ventilator. Intensive care at home provides a win-win situation for all stakeholders, improves the quality of life for your dad, improves the quality of life for you and your family, frees up the ICU bed, cuts the cost of the ICU bed by about 50% of the cost, and weaning at home is still possible. Okay, so that is my quick tip for today. Now, we have a membership for families of critically ill patients in intensive care at intensivecarehotline.com if you click on the membership link, or if you are going to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via emails, and we answer all questions intensive care related. I have worked in intensive care for over 20 years in 3 different countries, where I also worked as a nurse manager for over 5 years. And And I've been consulting and advocating for families in intensive care for over 10 years all over the world as part of my intensivecare-hotline.com professional consulting and advocacy service. I can say without any exaggeration that we have saved lives for families in intensive care with our consulting and advocacy. We have saved lives, we improved outcomes, we've done it all really and gotten the results for the clients that they wanted. Have a look at our testimonial section and have a look at our podcast section for some client interviews to verify what I'm saying. I also offer one-on-one consulting and advocacy for families in intensive care over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly, and I will help you navigating this incredibly difficult landscape that is intensive care through proven tips, tricks, strategies. And, I will help you to understand what's going to happen next, what to anticipate, what's going to happen next, how to manage intensive care teams, what questions to ask. But I also talk to doctors and nurses directly on your behalf and with you, of course. And I ask all the questions that you haven't even considered asking, but you must ask in order to make informed decisions, have peace of mind, control, power, and influence. I also represent you in family meetings with intensive care teams. Once again, you will need clinical and advocacy representation in family meetings with intensive care teams. You need a strategy when dealing with intensive care teams. 99.9% of families in intensive care have no strategy whatsoever, and they're running towards the fire. They're walking into these situations blindly, only to find out that they get walked all over. You need to have a strategy when it comes to intensive care teams, and that's where I can help you fast. Now, we also offer medical record reviews in real time so that you can get a second opinion in real time. We also offer medical record reviews after intensive care so that you can get closure if you're suspecting medical negligence, or if you have any other unanswered questions, we can do that for you as well. And all of that you get at intensivecare-hotline.com. Call us on one of the numbers on the top of our website, or send us an email to support@intensivecare-hotline.com with your questions. If you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, or what questions and insights you have. Thanks for watching. This is Patrick Hutzel from intensivecare-hotline.com and intensivecareathome.com, and I will talk to you in a few days. Take care for now.